Hi, I'm Dr. Joy Bryant, board-certified family medicine physician, and today I want to talk to you about something I see the downstream effects of every day in my clinical practice. What processed sugar is actually doing inside of our bodies. Not just weight gain, not just empty calories. I'm talking about liver damage, cardiovascular disease, systemic inflammation, and neurological harm. The research on this is clear, and I think everyone deserves to understand this in plain language. So, let's get into it. When you eat processed sugar, soda, a packaged snack, a store-bought flavored yogurt, your blood glucose rises rapidly. Because these foods have almost no fiber, it's hard to slow down the absorption in your body. Your pancreas responds by releasing insulin, which is the hormone that moves the glucose from your bloodstream to your cells. Healthy metabolic state, that system works very well. The problem comes when the process happens repeatedly, multiple times a day, over months and years. Your cells become desensitized to insulin signals. They become flooded so many times that they just start to ignore it. And this is called insulin resistance. In family medicine, it's actually one of the most common medical conditions that I manage. It's the metabolic foundation to type 2 diabetes. It develops silently, often for even up to a decade before a patient ever gets diagnosed. Here's something most of my patients are genuinely surprised to learn. And it's one of the most clinically significant parts of this conversation. Processed sugar isn't just glucose. Processed sugar, or also known as table sugar, is actually half fructose and half glucose. High fructose corn syrup, present in majority of ultra-processed foods, is predominantly fructose. And fructose has an entirely different metabolic pathway than glucose. While glucose is distributed throughout your body to be used for energy, almost all of fructose goes directly to your liver. And when you consume it in excess beyond the amounts that your liver can take, which, let's be honest, most of us are beyond that threshold, the liver converts that fructose into fat. And that fat starts to accumulate in our liver cells. Over time, this can lead to what we call non-alcoholic fatty liver disease, which now affects approximately 1 in 4 adults globally. Most people have no symptoms in the early stages, and routine blood work or imaging is often the first sign that something is actually wrong. If left unchecked, non-alcoholic fatty liver disease can actually progress to something that we call NASH. NASH is basically active inflammation in your liver and liver cell damage. From there, it can develop into fibrosis, cirrhosis, hepatocellular carcinoma. All of these are on the table as possibilities. The unfortunate part is all of this can be driven by what most people consider a normal diet. Now, this is the section I want you to pay the most attention to, because inflammation is the thread that connects all the other systems that we're going to discuss. When you consume excess processed sugar chronically, your body enters a state of low-grade systemic inflammation. This is not the acute inflammation of a sprained ankle or a healing wound. This is a persistent, body-wide inflammatory state that operates quietly in the background. And it's one of the most damaging things your diet can do to your long-term health. And here's how it works. Chronically elevated blood sugar drives the formation of compounds called advanced glycation end products. For short, we'll just call them AGEs, or aging toxins. These are compounds formed when sugar molecules bind to protein and fats in your body. AGEs bind to specific receptors on your cells and activate inflammatory pathways throughout your body. This can lead to damaged blood vessel walls, stiffened arterial tissues, and is directly linked to accelerated aging at the cellular level throughout your entire body. At the same time, excess sugar, particularly fructose, damages the integrity of your gut lining. It disrupts the proteins that keep your intestinal barrier intact. When the barrier is compromised, you get increased intestinal permeability. This leads to bacterial endotoxins seeping through the barrier and going into your bloodstream. Your immune system recognizes this as a threat and triggers an immune response. The result is a state of low-grade endotoxemia, or basically systemic inflammation that is persistent, body-wide, and silent due to the chronic release of inflammatory markers. What was designed for short-term defense becomes destructive when chronically elevated. Chronic low-grade inflammation is now understood to be a shared underlying mechanism in heart disease, type 2 diabetes, cancers, autoimmune disease, chronic fatigue, and neurodegenerative disease. And a high sugar diet is one of its most consistent dietary drivers. Something I want to highlight that has immediate practical relevance for every single one of you, especially during cold and flu season, is chronic high sugar intake directly impairs your ability to fight infection. This happens through several mechanisms, and it starts almost immediately after you eat. Research shows that eating high amounts of sugar results in a measurable suppression of your neutrophil function. Think of your neutrophils as your first responder white blood cells, the ones that show up to engulf and destroy pathogens. Within 1 to 2 hours of consuming a large load of sugar, activity of these cells decrease significantly, and that suppression can last for up to 5 hours. So every time you eat a sugary meal or drink, your immune response during the very window that you may need it the most. Chronically, the damage goes deeper. High blood sugar produces breakdown products of glucose. These breakdown products will actually bind and alter your antimicrobial peptides. Basically what I'm saying is the high sugar creates byproducts that decrease your body's ability to kill off pathogens. And research shows that this reduction could be up to 50% in these cells. This is part of the reason why diabetics are so much more prone to infections such as wounds, pneumonia, UTIs. The chronic inflammatory state that we mentioned previously, the ages that we talked about earlier, directly damage your arterial walls, less elastic, more stiff, more prone to injury, and more susceptible to plaque formation. Simultaneously, the liver that is overwhelmed by the excess amount of fructose takes that fat into the bloodstream in the form of triglyceride. And we all know triglycerides is a well-established cardiovascular risk factor. The elevated triglycerides combined with the arterial inflammation and the endothelial damage accelerate a process we call atherosclerosis. And the data on this is very compelling. High added sugar intake is associated with a 20% increased risk of cardiovascular mortality. And I want to stress this risk is not limited to just overweight people. You can have a completely normal BMI and still have significant metabolic and cardiovascular risk driven by sugar consumption. The visceral fat, the fat that's surrounding your organs, is very metabolically active and very pro-inflammatory. And this does not always show up on the outside. The last system I want to cover is the brain. And this is where the inflammation story comes full circle. The same inflammatory markers that are circling throughout your body can cross the blood-brain barrier. Once inside the central nervous system, they activate microglia. Think of microglia as the brain's resident immune cells. Chronically activated microglia release their own inflammatory signals. This creates a self-reinforcing loop of neuroinflammation, and this disrupts normal brain function and is associated with neuronal damage over time. At the same time, insulin resistance in the brain impairs neuronal glucose metabolism. The brain requires insulin signaling for healthy neuronal function. And when the signaling is impaired, glucose metabolism in neurons becomes disrupted. Some researchers refer to this as type 3 diabetes, though I want to be clear, this is still a very active investigation and is not consensus terminology. But what is increasingly supported by the evidence is the association between chronic high sugar diets, elevated risk of cognitive decline. Research shows measurable changes in dopamine signaling pathways after just a few weeks of high sugar, high fat dietary patterns. And yes, this is the same reward circuit involved in substance dependence and addiction. And this is why cravings feel so powerful and so difficult to resist. It's not a lack of willpower, it's biology. As a family medicine physician, I share all this not to create fear, but because I see the consequences of this every day in real patients. And I believe that access to clear, accurate medical information changes outcomes and allows informed people to make better decisions. The good news is that the body is remarkably adaptive. By you starting to reduce processed sugar, reducing added sugar intake has shown improvement in liver fat, insulin sensitivity, inflammatory markers, and blood glucose variability within a few weeks. Small, consistent changes matter, and they start by understanding what you're working with. If this was helpful to you, please share it with someone that you know may need it, and drop a comment. I would love to hear what part surprised you the most.